Hi everyone and welcome to the Aurora Blueprint. Thank you for joining us again. I'm joined by Dr. Sarah Page, who's a consultant dermatologist. Sarah, today I wanted to talk about skin changes after weight loss, particularly loose skin, as well as facial volume loss. So it's a big question the patients ask all the time of, am I going to have loose skin after weight loss surgery?
I think the answer is yes. I mean, if you have had mass weight loss, there will be some loose skin, and it also depends a little bit on how much weight you've lost and for how long you have had the skin under tension. So the skin will stretch if it's been under tension for a long time, or how much it has been under tension. Then once you do lose the weight, then you will notice there is some loose skin.
And does that apply for both the face and the body?
The body there would be more under tension than the face, and so you will notice loss in both the body and the face. Probably the face may be a little bit less obvious than on the body. So I think you would expect to have it in both areas. Yeah, it just depends. I mean, I think the main thing is it just depends how much movement of the skin has to make. So if you have lost a lot of weight, then the skin has to adapt to your new shape. And if your new shape is very different from your old shape, there will be more loose skin. Yeah.
And to start off with, is there anything a patient can do to prevent the amount of loose skin that they experience?
So I don't think there's any magic solution, honestly. I think the main thing is nutrition always, trying to get your skin in the best shape that it can be, and that's by sun protecting, making sure you've got a really balanced diet, enough protein, enough of all the nutrients, you're getting exercise. I think it's really looking at after your whole body health for good skin health. And then I think it's also how quickly you lose the weight. If you lose the weight very rapidly, that can trigger more sort of loose skin than if it's more of a steady weight loss.
I'm so glad you said that because we talk a lot about protein first, engaging with the dietitian, keeping well hydrated so they don't bounce because of dehydration, but also the multivitamins that they need to be on for life after surgery, things like that. So that's great to hear. What treatments are available?
It depends how much loose skin you've got. So, I mean, in terms of the face can sometimes be a little bit easier to correct because there's often a little bit less loose skin. So with the face, there are lots of different treatments. I mean, we have topical treatments, prescription medications that can help improve the collagen in your skin, but those ones need to be used, like a retinoid needs to be used on a regular basis. It's not a miracle worker, but it will make a difference to the integrity of your skin. Then we have other things like injectables, bioremodeling type of products, which are quite new on the market, and they actually stimulate you to make your own collagen. And then we obviously have lasers. So I do quite a lot of laser. We have low-end lasers to quite powerful lasers, which will help tighten the skin. There's always a limit to everything, and there are some people who we won't be able to do what they want with just non-invasive surgical procedures, but we can do quite a lot, yeah.
And for the surgery, I guess we're talking about abdominoplasties for those that need it, but like you say, the majority don't need to go down that path.
No, and especially I think facial rejuvenation, we can actually do quite a lot with products that we've got, and people don't necessarily have to have surgery. But we'd always be very honest with people, and we're not going to offer them things that we don't think are going to make a difference. There are options. I'd say there's options, but a lot of people won't need those. They'll just need basic skincare. And I think the thing about skincare, it's become very trendy at the moment, but you don't really need that much to look after your skin. You don't have to spend that much money. You need a good sunscreen, maybe a retinoid and a bit of moisturiser, and that's it.
I was going to ask you about that. Yeah, what would you consider the things that are a waste of money, things that patients shouldn't spend their money on?
I don't think you need to spend very much money on any of the additional things. Like there's quite a few popular trends at the moment: Korean skincare, facial masks, collagen masks. All those things make you feel nice, but they don't really do much. Yeah. So I would say just invest in a good moisturiser. It doesn't actually have to be expensive. It just has to be something that you like wearing as a sunscreen. If you like wearing a $20 sunscreen, buy a $20 sunscreen. If you like a $50 one, buy a $50 one. But what you like wearing, and then invest in a couple of actives. By that I mean something that's going to help with pigment if you've got pigment issues, or help with turning over the skin. Generally, skin looks younger when you start to get the cells to turn over quickly, and that's why retinoids work, and that's why things like glycolic acid works. It makes your skin look lighter and brighter, which is what younger skin looks lighter and brighter because the skin cells turn over quicker.
Oh, that's good to know. So at what point should people think about surgical removal of skin?
It depends how much excess skin they've got. If on, their abdomen they have a very large amount of skin, and I think they could probably get advice from your clinic as well about this, it's probably not going to be worth seeing me as a dermatologist if there's too much of a volume of skin. So those groups of people probably need to see a surgeon, a plastic surgeon. For the majority of people, they could just wait a period of time and see how it corrects and see how their skin adapts, because skin can still adapt. And they might just want to wait, 3-6 more months and just see how everything settles in the end. Yeah.
I completely agree with you. I think for my patients, I strongly advise them to go through that adjustment period, wait at least 2 years from the time of surgery, because it's amazing amounts of weight loss and metabolic shift, but it is an enormous shock to the system. So a bit more time is, I think you're right, is key. Yeah. So how do you support patients through that adjustment with loose skin?
So, I think the main thing, like you were saying, is actually just acknowledging that it's quite distressing to people. Maybe if they're not quite aware of what they'll be left with, they might feel a bit stressed about that. So I think it's being supportive, and then just, like you said, really trying to delay any major decisions for a number of years to actually see how their body adjusts. And then we can offer them other options. There's lots of different things that we can do, but just sort of explaining their options to them and seeing, how what works for them, and then trying to make sure very much what your team does, so making sure that nutritionally they're supporting their skin, not smoking, balanced diet, all of those things are important as well. But there's not a magic solution for everybody. Yeah,
no, that's true.
Yeah.
And for the non-surgical options, when's the optimal time to look at that? And I must admit, it's something I don't know anything about. I know for surgery we say 2 years plus, but for the non-surgical options that you've gone through, when's a good time?
Yeah, I don't think there's an exact time frame. I would say for a lot of people, I'd prefer them to just settle in to their new body and lifestyle, for at least, 6 months or so, and then come and have a chat to us. We're always happy to see people before if they're really concerned, but I agree with you. I think it's worth them just having a period of time to see how things all settle out, because their weight may adjust a little bit. They may lose a lot of weight and then have a little bit of adjustment of that weight, and it would be a shame to spend money trying to, add injectables or volume when they might not need it. So, yeah.
Thank you for that. It sounds like some changes in volume, particularly loose skin, is a part of the journey. But it is a transformative process and it can be managed. Did you have any final words for our patients?
I think the main thing is that they shouldn't feel worried or ashamed of anything that's happened, because it's an amazing achievement to lose that much weight, and their health benefits, far outweigh, some loose skin, and we can manage that to an extent, but they should be proud of themselves and their body, really, because it's an amazing process. So
thank you for that reassurance, Sarah. I really appreciate it. Thank you for your time.
Thank you.